Want to elevate your patient's oral health routine? Count on the Church & Dwight Hygiene Squad for your recommendations. 4 brands that work together to provide a better at-home hygiene experience.
Hi, I'm Dr. White. I see many patients still using a manual toothbrush, and I tell them power toothbrushes are more effective at removing plaque. As dental professionals, we know this from the data, and we know this from looking at our patients' teeth. It's not easy to get all the plaque in some places. That's why I recommend the new Adult Spinbrush Power Toothbrush. It removes up to 70% more plaque than a manual toothbrush in hard-to-reach places. Spinbrush works 2 ways to remove more plaque on tooth surfaces, between teeth and along the gum line, with brush heads specifically designed to remove plaque and whiten teeth. I tell my patients it's less than $10 and it's a huge improvement over manual brushes. I encourage them all to try one, especially the new and improved Spinbrush.
Well, I've recommended Arm & Hammer toothpaste for several years now for a couple of reasons. The key benefits to Arm & Hammer baking soda toothpaste is, first of all, the baking soda, which has a neutralizing effect in the oral cavity by raising the oral pH. The fact that we're constantly under acid attack from our food and from the bacteria that cause decay and periodontal disease really necessitates having a balance of pH. The second reason is for its low abrasivity, and that's a key factor in Arm & Hammer baking soda toothpaste that separates it from others. The problem with so many of the whitening toothpaste on the market is they're highly abrasive. They whiten by stripping away tooth structure. That's not the case with Arm & Hammer. Arm & Hammer uses peroxide, baking soda, and a low abrasivity toothpaste to whiten teeth. In our practice, you're only gonna find one brand of toothpaste, and that's Arm & Hammer.
What makes TheraBreath Mouth Rinse better? Science, honesty, and purpose. Hi, I'm Anthony Strigliano, one of the product development engineers behind TheraBreath Mouth Rinse. I'm here to explain the science inside every bottle. We're on a mission to make mouth rinse less complicated, so we keep our science simple. It's all about the ingredients. Each formula contains only intentional ingredients like sodium fluoride, cetylpyridinium chloride, and sodium chloride. And we choose these ingredients because we know they deliver the results that dental professionals and patients expect. For instance, our Fresh Breath rinses are clinically shown with the ADA seal of acceptance to fight bad breath differently with the power of sodium chloride. What's sodium chloride? It's an oxygen-rich ingredient that targets anaerobic bacteria which produce volatile sulfur compounds, or VSCs, which cause malodor. Fresh Breath Mouth Rinse works by fighting the bacteria and neutralizing the malodorous compounds effectively. Yes! Our other rinses work just as effectively, and it's because we take the simple approach of formulating with intentional ingredients only.
What makes TheraBreath Mouth Rinse better? The honesty under the orange cap. Hi, I'm Caitlin Dodd, TheraBreath team leader. I believe in our brand because of its honesty, which means being transparent about what gets splashed into our rinses and what doesn't. Our formulas are simple but effective, and the entire line is alcohol-free, sulfate-free, paraben-free, and dye-free. We like to say the TheraBreath difference is clear. Everyone's personal choices matter too, so every TheraBreath rinse is certified vegan, gluten-free, kosher, and halal.
Hi, I'm Angela and I'm a dental hygienist. As a hygienist, I believe TheraBreath Mouth Rinse is better because it's formulated by a dentist for specific patient needs. Having a full line of condition-specific rinses makes it easy for me to recommend and easy for my patients to understand their benefits. Anti-cavity helps fight cavities for 24 hours. Perfect to use at night for caries-prone patients. Healthy Gums contains the active ingredient CPC, which is proven to fight plaque and gingivitis. Dry Mouth contains naturally sourced enzymes that stimulate saliva flow. Whitening works without peroxide using naturally sourced stain-fighting enzymes. And Fresh Breath, which is purposely powered by oxygen, starts working instantly to fight bad breath for 12 hours, supporting a well-balanced oral microbiome. Fresh Breath also packs an extra punch. It's pH balanced to neutralize acids. Patients agree, it's a better mouth rinse. See for yourself.
For 2 decades, I did everything I could to keep my breath fresh. Continuous brushing, mints, gum, tongue scrapers, you name it. No matter what I did, my breath could not stay fresh until this product. It completely changed my life and helped me to have more confidence. So very thankful for this product.
Try the TheraBreath difference for yourself.
Are you struggling with getting your patients to string floss? Most patients don't know how to floss correctly, or they struggle to use it. In fact, 8 in 10 dental professionals regularly recommend string floss, but only 1 in 3 adults report daily flossing. So how are we helping the other 70%? By recommending Waterpik water flossers. Waterpik water flossers are supported by 80 published studies. This amount of research is rarely seen on self-care products, and it tells you a great deal about Waterpik's dedication to providing the best evidence to you and your patients. Unlike string floss, water flossing is easier to use and is less technique sensitive than string floss. And when it's easier to use and see results, patients will comply. Plus, your patients will love you for the recommendation. Waterpik users love to water floss. They're obsessed with that daily, clean, water-fresh feeling. That's what makes the Waterpik water flosser the perfect solution for every patient, especially those that need to do a better job removing plaque and reducing gingivitis. The Waterpik water flosser uses a combination of pulsation and pressure to powerfully yet gently remove 99.9% of plaque biofilm. Waterpik water flossers are clinically proven to clean between teeth and below the gum line, where the traditional brushing and flossing can't reach. Rinsing penetrates about 2 millimeters. String floss reaches up to 3 millimeters, missing deeper pockets. For the Waterpik water flosser, research shows it can disrupt bacteria up to 6 millimeters, so it penetrates deep between teeth and into pockets and any hard-to-reach area. Anyone who needs periodontal maintenance or has implants, crowns, and bridges can benefit from using a water flosser. And water flossing with the classic jet tip is 29% more effective than string floss at overall plaque removal. But where it counts is the proximal region. Sometimes when patients use a power or manual brush, they think it's all they need to improve their oral health. These studies show that whether you use a power or manual toothbrush, adding a Waterpik water flosser to your patient's brushing routine reduces overall plaque, bleeding, and gingivitis. Non-flosser patients or those with poor brushing will also benefit using a water flosser. The Waterpik water flosser was the first powered interdental cleaner to receive the ADA seal of acceptance for removing plaque along the gum line and in between teeth, and helping to prevent or reduce gingivitis. Recommend the brand that was invented by a dentist and engineer with over 60 years of water flosser innovation. You and your patients will see incredible results. End the struggle, share your obsession with the Waterpik water flosser, and all your patients can have cleaner teeth, healthier gums, and better dental checkups.